Hi everyone, this is Dr. Cole Handy Jones here with your handy physical therapy tip of the day. Today I want to talk about plantar fasciitis. I want to explain a little about what the plantar fascia is and what it does, why it's so important, and what leads to plantar fasciitis. Then I'm going to give you a few stretches and exercises that you can do to start to remedy this horrible disease. Before I get started, don't forget to subscribe, hit the like button, and please leave any questions or comments below and I'll respond as quickly as I can. Plantar fascia is a very frustrating and stubborn condition. I always tell people it takes time, but also consistent efforts within that time to truly get it better. So don't give up if you've had it for a long time. I think you'll find a few things in this video that will really help. Plantar fascia is one of the most common foot conditions that I see. It affects approximately 2 million people a year, and it has a huge devastating effect on your life. Plantar fasciitis usually comes on over time. It's not one specific event that causes the pain. It gradually gets worse and worse and worse. The most common symptoms that I hear in people is usually have pain that is worse first steps in the morning. So right after you're laying in bed, you get up and those first steps in the morning, you really limp and can barely walk along. But then as you do a little more, it gets better and better and better. Same thing perhaps if you have a desk job or get home at night and you've been sitting for a while. Then when you first get up and start to walk again, it will be really painful, but then it'll get better the further that you walk. Some of the things that lead to plantar fasciitis is being overweight or obese, having either a really flat foot or a really high arch, or a recent change in activity level. Perhaps you started running when you haven't before. Perhaps you started a job where you're up on your feet all day long, or maybe you have a new footwear that you're using. Or just find yourself on your feet more often. I want to explain a little bit what the plantar fascia is so you understand it and why it's so important. To do that, I'm going to draw on my foot and kind of show you where it runs. So the plantar fascia starts right in front of your heel. So you find your big heel bone here, okay? It kind of starts right in front of it, right there, okay? And then it has insertions that go to each toe, okay? So it goes along here, to the base of the toe, the next one, and so on and so forth, okay? Now this tissue in there is really thick and dense. I usually compare it to as thick and dense as a leather belt, okay? So it's all along here in this pattern, okay? The point of the plantar fascia is to absorb forces as we're walking. It almost kind of acts like a shock absorber on our foot. So every time we walk, our foot is able to absorb the force we're at, and then it gets rigid again to be able to push off and move us forward when we're walking or jumping or running or whatever it is. The plantar fascia is central to that. Okay? The plantar fascia absorbs about 110% of your body weight with every step that you take when you're walking, and about 250 to 300% of your body weight anytime you're running or jumping. So you can understand how important, how much stress goes through this plantar fascia. Okay? One thing that I think people often miss when they think about the plantar fascia is it's not just right here. It actually has direct connections that go behind the heel and back into your Achilles tendon and into your calf muscles. So a lot of the things that I'm going to show you today are going to have to do with the calf and actually going after stretching or strengthening the calf to help relieve the tension on the plantar fascia. So the first two things that I want you to do is to stretch out your calf muscle. Now when we stretch the calf muscle, there are two main muscles that affect the plantar fascia that are in the calf. So we want to make sure we address both of them. What I found when I treat patients is that most people are just addressing one of those muscles. Okay, so let me explain. So the first stretch that I need you to do, you just need to find a table or a wall to lean against. Okay, so I'm going to find a wall here. I'm going to use my my mantle right here. I'm going to put one foot behind the other. So my left foot right here is the one that I say I have plantar fasciitis right now. My heel's going to stay on the ground. My toes going to stay pointed forward, keeping my left knee nice and straight. I'm just going to lean into the wall and stretch my calf. Okay, I'm going to feel the stretch in my calf, usually a little higher up, up here, even behind the knee ever so slightly. Okay. I'm going to feel a little bit of a tensiony and hold for 30 seconds, okay? That's enough time usually for the tissue to actually elongate, okay? You shouldn't have pain in the foot with this, maybe a little bit of stretchy, but it shouldn't be much pain, okay? The second stretch that we're going to do is going to be very similar to the first stretch, but usually this muscle is the bigger culprit to plantar fasciitis. So this is usually the more important one, and usually one that I find that most people have not done yet or have not tried. Okay, so I'm going to take my foot with the plantar fasciitis and put it behind my other foot. Just like the last stretch, my heel's going to stay on the ground, my toes are going to stay pointed forward. But here's the variation. Now I'm going to take this knee and I'm going to bend it like I'm trying to bring my shin down towards my toes. Okay, same thing, I'm going to feel a little bit of a stretchy and I'm going to hold for 30 seconds. Okay, now this one you should feel differently than the other one. When I do this stretch, you should feel it lower down in your calf muscle or even perhaps in your Achilles tendon. Okay, because this muscle that we're stretching is the lower muscle in your calf. Okay, and same thing, I'm going to hold for 30 seconds. Some things to look for when you're doing these stretches that you should not do. Okay, first of all, I do not want to have my toe pointed out at all. Okay, if I'm doing it like this, you are doing it wrong. If it's a straight knee or the bent knee, okay, I want that toe pointed forward the whole time. Okay, the next thing I do not want you to do when you're doing these stretches, I do not want you to let your heel come off the ground at all. Okay, like this, or when I'm doing this one, keep that heel down, toe pointed forward, and then we're going to stretch. The next exercise that I want you to do is to address ankle joint mobility. Okay, whenever we talk mobility restrictions in the body, there's two things that can cause the problem. One can be soft tissue or muscle. Those are the stretches that we just did. The next thing are joint. Okay, and joint restrictions are a big deal in plantar fasciitis. So for this one, what I want you to do is I want you to use either a stair in your home or a step stool. So I'm going to use the step stool. Okay, for me, I'm going to take my foot with plantar fasciitis, that's my left foot, and I'm going to put it on the stool. My heel's going to stay down, my toes going to stay pointed forward. I put my hands on something to help take a little bit of weight off my foot. And then I'm going to take my knee and just put it forward like I'm trying to bring my shin down towards my toes. Hold it for a second or two, and then come out. Bring my shin forward like I'm bringing my shin over my toes. Hold it for a second or two, and out. And I'm just going to rock back and forth. Okay? For this one, I usually say do 20 to 30 reps a couple times a day. When I'm doing this one, what's most normal to feel is to feel it in the front of the ankle, okay? That means you're really addressing that joint mobility restriction, okay? Every now and then, if you have a really tight calf muscle, you might feel a little more in the back. That's okay, but it's ideal to feel it up here, okay? And we're just gonna rock back and forth. The reason that we're rocking is because we're addressing ankle joint mobility, okay? For soft tissue or muscles, we hold stretches for time. For joint mobility, we go in and out of it, just like this. The things you should not be doing during this exercise are very similar to the last one, okay? I do not want your toe to be turned out at all. I'm trying to go forward and back like that. And when you go forward and back, I do not want your heel to pop up at all, okay? Keep that heel down, toe pointed forward, and rock in and out, just like that. Thanks for watching the video. I hope you learned something valuable and this can help you with your plantar fasciitis. Remember, please don't forget to subscribe, hit the like button, and put a comment down below. I love questions and I'm excited to get back to you as soon as I can. My question of the day for you, are there any other stretches or exercises or things that you have done for your plantar fasciitis that you feel like really help? Put them down below. I think it only helps everybody else to get different ideas. Thank you so much. I was going to say.